Thank you for joining the Office for Human Research Protection's webinar series on the Common Rule. Today's webinar, Doing Research with Data and Biospecimens Under the Common Rule, Part 1, What Researchers Should Know, will be presented to you by DED Director Dr. Yvonne Lau. This webinar will be recorded and will run for a total of 75 minutes, including a live Q&A session. If you have questions, please submit them through the chat. Certificates of attendance will be issued to all who have registered. The slides will be available on OHRP's website under the past events section, and the recording will be available in around a month. We will go ahead and get started, and I'll pass it on to you, Dr. Lau.
Hello, everybody. I'm very excited to be here, to be with you today. I just read on the news that there is apparently a big snowstorm and very severe wind condition over on the West Coast and some other parts of the states. So I appreciate all of you who can join us, and hopefully we'll have our numbers up through over the course of this presentation. So for this particular presentation, it is a continuation of a series that we began about a year ago, focusing on the various aspects of the regulations for human research protections. So last year we covered the basic principles, and this particular series that we are starting today. There are 4 to this series, and we're going to touch on slightly more complex issues. So for those of you who are not so familiar with the basics of the Common Rule, we do encourage you to go back and review the videos or the slides for the presentations that we did a year ago, and you'll be able to find those on the OHRP Education and Outreach site, either so on that site, you go to Human Research Protections Training. So there's a tab for that, and you can find all the material, or you can also go to where Zena talked about, the OHRP website, events, and under past events. All right, without further ado, I'm going to start this presentation. And this is our usual disclaimer. So the opinions expressed here are those of mine and do not necessarily reflect the policy of the U.S. Department of Health and Human Services. And for the purpose of education, we try and simplify some of the regulatory language. Please do refer to the original text. They can be found on our RP website. That's where you can find the complete and accurate wording for the regulations. So this is the overview for today's presentation. We're going to be talking about research with data and biospecimens, and the focus here is on the concept of secondary research. This is a very common type of research, and we get a lot of questions about how to do research, how to do this kind of secondary research with data and biospecimens. Now, as you well know, OHRP's jurisdiction really cover research that is funded, so supported and conducted by the Department of Health and Human Services. Obviously, what we're talking about are Common Rule regulations, so generally that apply across Common Rule agencies and departments, but individual department and agencies might have their own nuanced interpretation as well. So if you are getting funding from them, you should refer to them to just verify how they precisely interpret the regulations. Now, if you're outside, if you're not getting funding from federal Common Rule agencies and departments, from the HHS, then the Common Rule regulations, I'm going to say, you don't have to follow them. You don't have to be compliant with them. We don't have a jurisdiction. But I do understand that most institutions, as a part of institutional policy, would follow the Common Rule. So that could also be relevant in that sense. But then, we just don't have the jurisdiction to say that you're not non-compliant. But the institutions might have a qualm with you. All right, so the outline for today's presentation. I'm going to talk about secondary research, the definition of it, and how to distinguish it from primary research. Now, these are really, really important concepts, and it just pays to get it very clear in your mind how you think about primary and secondary research. So we'll spend quite a bit of time talking about that. I'll talk about the famous what is identifiable under the Common Rule, and then how Common Rule applies to secondary research with data and biospecimens. So first, the concept of secondary research. This is the research use of information or biospecimens, individual information, obviously, or their biospecimens that are originally acquired for non-research purposes. So what are these, right? So in the case of biospecimens, I would imagine that most of the situations that you get hold of these biospecimens would be, following a clinical diagnosis, following clinical care, clinical treatment. So for example, people going to their doctor, having their blood taken to, as a part of their routine clinical care, or that they require some sort of a biopsy to make a diagnosis of their condition, or in fact, they might have gone for surgery because of their condition. So the purpose was done for non-research purposes. And in the case of data, as we've talked about this, and everybody knows, data is just everywhere these days, right? So any kind of data that was collected for other purposes other than research. So I mean, CMS collects a lot of data. The Census Bureau, we've just finished the census exercise, and there's a lot of data being collected. You go and register for a membership for somewhere, or you go and register to attend a course, you supply information, there's data being collected for those purposes. All right, so those are the research use of information about biospecimens originally acquired for non-research purposes would come under the concept of secondary research. Now, this could also be, the information about specimens could also have been collected for research studies. The essential thing here is that for them to be considered as secondary research, those materials would have been collected for research other than the one that investigators are currently proposing, right? That they are currently saying, okay, we want to do this research, we want to use the specimens. But the specimens or the information that they want to use would not be information or biospecimens that they are collecting, through this current research they're proposing. So an example would be, so information collected for a drug study on Alzheimer's, right? Now it's being used to study if early onset diabetes predisposes an individual to Alzheimer's development. So it's different research study, all right? So hopefully you kind of get the sense of what I'm talking about, right? Now, the concepts of primary research and secondary research actually very much linked to the regulatory definition of human subject at 46.102E1. So the regulatory definition for human subject is a living individual about whom an investigator conducting research obtains information or biospecimens through intervention or interaction with the individual. So this is the first part of that human subject definition. Any time that for the purpose of your research, you propose to collect information or biospecimens from individuals through intervening with them, doing stuff with them, manipulating their environment, or interacting, surveying them, asking them questions directly, then you are doing human subjects research, fits into the definition of human subjects. And this is what we would refer to as primary research, all right? And for most of these primary human subjects research, right, they will require IRB review according to the regulatory definitions, most likely informed consent as required under the regulations, unless the whole research meets the condition for one or more exemption categories described in the common rule. All right, so primary human subjects research, many of them will require the regulatory defined IRB review, informed consent, and other kind of related common rule requirements, unless the whole research fits into one or more exemption categories. All right, I want to say a little bit more about primary research still. So it is primary research if the activity, and we're talking about the intervening and interacting to collect data for the research, right? That particular activity is conducted on the behest of the investigator for the purpose of that research being proposed. So it doesn't matter if it's not the actual investigator who is doing the stuff, right? It can be the staff, the colleagues of this investigator. It could even be the investigator hiring, let's say a survey firm to conduct the interactive, to conduct the survey, the interactive episode for the purpose of the research, right? As long as the as long as there's interaction or intervention as a result of this research, right? Then you have primary research happening. Now, even if the intervention, right, is a common clinical procedure, if it is carried out specifically for the purpose of the research, the activity will be considered primary research. So in other words, you need to focus on the purpose of that procedure and not just look at the procedure. So for example, if an investigator for the purpose of the research is proposing to do an MRI investigation of the brain, so MRI, as we know, it's a common clinical procedure for, looking at the brain. Now, if it's not done for clinical care purpose, but it's being ordered specifically for the purpose of this research, right? Whatever the reason, whatever the information that the investigator wanted for that particular research, then this would be primary research, okay? It is also primary research when, for example, additional biospecimens are collected for research purposes at the time of a procedure done for clinical care. And one of the commonest example would be, okay, well, we stick a needle into somebody, we're collecting blood, and we're collecting blood actually really for clinical care, right? So I went for a blood test a couple of days ago, and the practitioner took about 20 mils of my blood. But let's say investigators come along and say, oh, well, you know what, ask them if they're willing, through that same needle puncture, we would like to get an additional 10 mil for, to contribute to our research, right, for a research purpose. Now, that will also be primary research. That will not be second, because you are asking for additional material being collected through an intervening procedure, specifically for the purpose of the research. All right, so I hope that I've made it very clear what primary research is. Now, remember, there are two parts to the definition of human subject, right? So we just talked about the first part. Let's say there is no interaction, no intervention to collect individuals' information or biospecimens for the research. So that's out. We're not talking about primary human subjects research. What about the second part of the definition? So the second part of the definition, it's an or, by the way, so it's either or. So if the first one doesn't work and you look at the second one, okay, investigators obtaining, using, studying, right, without interaction, intervention, right, just have, use this, have access to this and study this information biospecimens, and they're identifiable, right? They're identifiable private information or identifiable biospecimens. Then what do you have? You have a case of human subjects research, right? Because it fits into the human subject definition, but you also have a case that this would be what we call secondary human subjects research. All right. Secondary because there was no interaction intervention specifically for the purpose of collecting the material for this research. Right. Human subjects because you have identifiable private information or identifiable biospecimens. So you're going to ask, what happens if, we're just going to be doing secondary research, but all the things that we're getting and using and accessing is not identifiable? Well, that would be secondary research, not human subjects research. And as many of you know, that's a great advantage, because then it means that, well, you stop there. You don't really have to look further about what, to see whether common rule regulatory requirements apply. You are doing secondary, not human subjects research, and you're good to go, basically. All right. So let's just say a little bit more about the concept of secondary research, right? Again, I emphasize again and again and again, there is no interaction or intervention with individuals specifically to collect their data or biospecimens for the purpose of this proposed research. Hence, when we're talking about secondary research, we are focusing on the data and biospecimens that investigators are proposing to use. So we look at, okay, where the sources of these biospecimens or data come from. Now, we get a lot of questions, right? Asking, well, what about the supply of materials, right? Typically, common rule considerations are not applicable to the supply of the materials if supplying is their only role. All right. So in other words, you are somebody working in a hospital, and you've just been approached by some investigators to ask, okay, can we use the biological samples that are left behind after routine clinical care for a particular purpose, right? How you make your decision is not going to be associated with any interpretation of the common rule. It's if that's your only role, right? What you have to know is, okay, well, there may be institutional policies governing as to whether you are allowed to give out and distribute those samples. There may be other federal rules and regulations, like maybe if you are covered, if your hospital is a covered entity, then you may have to follow some HIPAA rules as to whether you're going to be able to provide that material for use downstream. So those are the regulations and policies that you want to consider, not the common rule. So when applying common rule, right, for investigators, I want to urge you. So, you often have to submit your protocol description of what you're doing to IRB, your IRB office, right, your HR, Human Research Protection program, the administrators there. And when you describe things, right, don't use the word collaborators easily, right? If your supply, if somebody is just supplying materials for you for secondary research, don't be so forthcoming and say, oh, those are my collaborators, because the moment you said the word collaborators, it's going to ring all the bells, and we're going to start thinking, okay, are you really doing secondary research, or are you actually having your collaborators interact and intervene with people, and that you're actually doing primary research? Right? So, try not to use that word, not because we want to be disrespectful, right? But it's just that it has a lot of connotations when it comes to how we apply and interpret whether the common rule regulatory requirements apply, right? So just to save yourself some trouble. And I have already said, right, identifiability is what makes secondary research, right, human subjects research or not, right, is the identifiability. Now, since we mentioned this word, we're going to talk a little bit more about it. So what does identifiable mean under the common rule? This is the definition that you are seeing. So identifiable private information or identifiable biospecimen refers to private information or biospecimens for which the identity of the subject is or may readily be ascertained by the investigator, or is associated with the information or biospecimens. And this is a definition in the regulations. Right. So look at this definition, right? I mean, it's kind of subjective, and we're going to say a little bit more about that. But notice that it does not, the common rule does not actually define associated terms like investigators like to use: coded, de-identified, anonymized, those terms. The common rule does not actually say anything about these terms. So I think it'd be best to avoid when the common rule may apply to your research. It's better to avoid using those terms because they're just not clear enough as to what you mean, right? At the end of the day, whatever you mean, it needs to come under this definition for us to be able to know whether we can decide that it's identifiable or not identifiable, right? So we also, for the purpose of the common rule, we don't have the identifiers as HIPAA might have, right? And many of you might think, oh, that is a pain in the neck, right? Because it's not clear. So there's not a list of all these things. If you don't have them, then you're not identifiable, and if you have them, then it's identifiable. It's not so clear. Yeah, it's kind of a pain like that. But at the end of the day, it also does provide you with certain flexibility, right? It's not any time that you have one or two of these so-called HIPAA identifiers in this that it will automatically be identifiable under the common rule, right? At the end of the day, you still have to look at whether what you're proposing fits into that definition of identifiable that I'm showing at the top. Then the other thing is unique identifiers under the common rule may not necessarily be automatically considered as identifiable under the common rule. And the example that I often use is fingerprints, right? Fingerprints are unique to an individual, right? But let's say I leave a fingerprint, here and there on a glass, and obvious, people can see it. But how many people would know that that particular set of fingerprints actually come from me? Right? So I think that's the subjectivity there, that allows you to kind of say, okay, well, something is identifiable or not, right? Look at the definition again every time that I mention some of these things. And the same goes with whole genome sequencing. I understand, whole genome sequencing, it's unique to an individual. It goes to the core of the person, or, of the individual. But again, how many of us have really, looking at all the A's and the T's and the, the pairings, would be able to say, okay, that belongs to Yvonne for sure, right? I mean, that's how we kind of look at, determining whether something is identifiable or not in the common root. Now, it's an evolving thing, right? I mean, every day we are hearing all these other techniques, and who knows, maybe 5 years later, any of us, having kind of access to any bit of information could easily, readily using those few index would be able to identify a particular individual. If that's the case, then yes, probably we have to change the definition of this. And in the revised common it does build in, a possibility of being able to redefine what identifiability means. Now, that said, okay, so fingerprints, right? You look at it and you probably would not be able to tell right away, okay, that belongs to Yvonne, but there are certain things that are kind of icky, right? So if you look at my image, my face, right? And if I look at my face being shown somewhere, I'm going to say, oh no, that is so identifiable, right? Same with a lot of voice recordings. So generally, OHRPs would consider frontal facial images and voice recordings of individuals to be identifiable. Now, it's not absolute. Again, the interpretation is what you see there, the definition is there. Now, if you can make a case for why, whatever you have, whatever you're using, it does not fit into that definition of identifiability at the top there. If you can make a convincing case, then you could potentially have a convincing case and say that that's not something that you collect, that something that you have is not identifiable. All right. So again, identifiability is a subjective standard under the common rule. It's a pain because then you have to make a convincing case and you have to look at the details of your case and then you may be making determination on a case by case situation. So you need to put in more intellectual inputs into making that case, but at the same time, it does allow a certain flexibility. So it's not any time that you have something there, it will automatically make it right away identifiable. Right. So there you go. I mean, I can give an example. For example, you might be collecting, you might have access to some biological samples that belong to a group of people with a rare condition. Right. And there's just so many people who have this rare condition in the country. And there are just a couple of investigators who really study this particular condition. Now, anytime you have such a small sample, and if you are kind of the expert in this area, so even if you just remove all the so-called general identifiers associated with the biospecimens of, that for people coming from people with this condition, it's probably not convincing enough that, it is ultimately really not identifiable to you. So you have, those kind of, nuanced situation, and you really need to consider what's the detail, what does the investigators have, right? And then make a case for it. Essentially, however, you can generally lean on the principle of one is looking to see if the data or biospecimens can be readily linked, right? Or readily represent a living individual by the investigators generally, or by the investigators team, right? The group of people who are doing the research. So it's not going to be like, oh, there are all these people who are so good at IT technology and they do a few maneuvers and they can immediately. No, it's not usually about those people, whether whether some people out there in the world have means to be able to identify these things easily, right? It's usually the readily link applies to the group of investigators proposing to do the research. All right, so secondary research, I've already mentioned that we don't really use the word coded, anonymized so much because it's not defined in the regulations. However, since I can't control you guys using it out there in the research community, and it's a very common word. So let's just say a few words about secondary research with coded materials. When is it not human subjects research, right? So when the research involves only coded private information or coded biospecimens and meets both of the following conditions. First one, investigators, including any associates on the research, do not interact or intervene with subjects to collect the materials for the purpose of this research, right? Do not interact or intervene. So in other words, that would refer to secondary research, right? So they're not doing primary research, they're doing secondary research. And second condition, investigators, together with the associates, right, cannot readily ascertain the identity of the individuals to whom the data and biospecimens pertain. In that case, you have secondary, you have not human subjects research, right? So this is a case of not human subjects research, and you are ready to go your merry way to do your research without having to pay any other attention to, what other common rule requirements may apply or not. So what if it's not the case that somehow, yes, you have access to identifiable materials for your research, right? Even if it's just initially, transiently. What happens? Does that mean that it will always require IRB review? Not necessarily. It just means that you are doing secondary human subjects research. And the next thing you want to know is, okay, well, I know I've heard about these exemption categories. So does my research fit into the conditions of one or more of these exemption categories? Right. The main categories, exemption categories that may be applicable for secondary research involving human subjects are these. You can find them at 46.104D. So exemption 4, 5, 7, and 8. Now I'm going to focus on exemption 4. And by the way, the basic common rule presentations that we did a year ago, we have, more detailed discussion of these exemptions. So like I said, we're not going to repeat some of the things that we have said, but I'll repeat enough for you to understand what I'm talking about today. So let's just focus on exemption 4. So these are the other ones are 5, 7, and 8. And just a word about 5, evaluation of public benefit and service programs. Usually that's related to some demonstration projects or things that CMS would do. Generally, I just have this way of saying it. You will know that you are, you will know that this exemption will apply to you if people would have told you, the people who give you the money would tell you that, well, this is, research public related to public benefit and service. So if you're an investigator, you haven't heard anything, nobody has mentioned that to you, don't try and fit your research into this exemption. Probably usually doesn't work. And then exemption 7 and 8 are the new exemptions that are available for secondary research. It does require the use of broad consent, and we know that not many people are using that, so I'm not going to focus on that. All right, exemption 4. It's the principal exemption category that are being applied to secondary research use of identifiable information or identifiable biospecimens. Remember, if your thing is not identifiable, you don't even have to get to this point, right? You don't have to think about exemptions. If your thing is not identifiable, your secondary research materials are not identifiable, you already stop. You know that you can go your merry way to do your research. So exemption 4. Applicable if identifiable materials are publicly available or information, which may include information about biospecimens, is recorded by the investigator in such a manner that the identity of the human subjects cannot readily be ascertained directly or through identifiers linked to the subjects, and the investigator does not contact the subjects or re-identify subjects. It's a full mouthful, but essentially what it's saying is that investigators at the beginning of it, they may have access, let's say, to clinical records, right? So it's identifiable to them. But for the research, they're just recording information, indices out of that record, right? And they're not recording any information that would allow them to easily link back to the individuals. Right. And again, that subjective standard that we talked about. And on top of that, the investigator is going to promise we're not going to re-identify the subjects with what the materials that we have, the information that we've recorded, and that we're not going to contact subjects. Right. So there's a, clearly indicating that there's a severance of the link. All right. So you may have identifiable information to start with, but for your research, you're going to completely strip that and you'll not be able to link it back to individuals. Then this exemption for part 2 might apply to your situation. And then the third provision is a new one under the revised common rule, investigators use. So this applies to HIPAA covered entities. When the investigators use is regulated under HIPAA as healthcare operations, research, or public health. And this means, so when this exemption applies, it means that okay, is exempt from the common rule. You don't need to consider further what the common rule requirements say. However, you need to follow what HIPAA's requirements are, right? So if HIPAA requires you to get consent, then you follow the HIPAA requirement, or HIPAA allows you to get a waiver, then you follow HIPAA requirement. Please note that because HIPAA only really talks, refers to information, right? Individual private information, not biospecimens. So if your research involves analyzing biospecimens, then this particular provision will not apply to you. And the last one is about using, government collected information and data. I'm not going to go into details with that. So these provision 2 and 4 and exemption 4 are the common ones that will encounter, most investigators will encounter doing secondary research. So a reminder about exemption categories. For human subjects research to be exempt, the whole project must meet the conditions for one or more exemption categories. All right. And for cooperative research that comes under the single IRB review mandate at 46.114, please don't even think about exemption categories at all. Take it out of your mind. Why? Because if 46.114, the single IRB review mandate, applies to your research project, we're talking about cooperative non-exempt human subjects research project. Yes, it's cooperative. So there may be multiple institutions involved in that cooperative non-exempt human subjects project. And some of these institutions themselves may only be analyzing, information or biospecimens that were sent to them by their, genuinely this time collaborators without any identifiable information for them, right? Now, under those kind of situations, you're talking about engagement. Your institution, if that's the only thing that your investigators are doing, then your institution may be considered as not engaged. You are not bringing in any of the exemption categories, because exemption categories only apply to what? Research that exempted, right? Not non-exempt human subjects research. All right, so human subjects research that meets the condition for one or more exemption categories, and for that matter, if it's not human subjects research even or at all, right? So it means that investigators and institutions have flexibility for the review and, the consent process outside of the regulations. There are times when no consent will be needed, or that, if it's reviewed, maybe just your IB administrator reviewing it, it's not necessarily requiring, the standard IB review that under 46.111. Now, I want to alert you to the fact that exemption 7 and 8, the new exemptions, it does actually have something called limited IRB review, right? I'm not going to go there, not going to go into details about that. Whatever it is, whether it's exempt, whether it's outside of the common rule jurisdiction, compliance is not and should not be your only interest. At the end of the day, it's the ethical responsibilities that we have to our research participants, to their rights and welfare, that is the most important in anything that you're doing. All right, so please pay attention to that. Now, this is just a reminder of the flow chart, the famous questions that we always ask you to ask in this order from left to right. Right? Is it research? Is it human subjects research? Right? And, where it says if it's not human subjects research, right, because you are doing secondary research not identifiable, then you stop. You see how the big red stop sign, right? The common rule, you don't have to think about common rule requirements anymore. However, if it's human subjects research, yes to it, then you ask the next question, is it exempt? And if it meets all the conditions for one or more exemptions, then you can stop there as well. And of course, if it doesn't, then you're talking about non-exempt human subjects research. At this point, let's go through a few scenarios in order to consolidate our understanding so far. So first scenario, simple one. Researchers contact a large medical center to obtain a data set on the frequency and distribution of certain diagnostic codes used in their electronic medical records, to study the implications of moving from one version of ICD codes to the next version. Is this secondary research? Yes, this is secondary research because the information is not originally collected specifically for the purpose of this current investigator's research. There is no interaction or intervention done specifically for this proposed research. So yes, this is secondary research. Is this secondary research human subjects research? So think about what we've been talking about, right? What hinges on whether this secondary research human subjects research is identifiability, right? So no, the answer is no, this secondary research is not human subjects research because the data set that the investigators will receive for their work does not include individually identifiable information. All right, so this is how we actually do every, kind of determination, right? We ask these questions. So scenario 2. A team of data researchers is given access to individually identifiable patient data in electronic medical records. So individually identifiable, okay, patient data in electronic medical records to conduct the research. The team will only record data that cannot be linked back to living individuals. They will not have means to contact individuals and agree not to re-identify the data. Is this secondary research? Yes, this is secondary research because the information is not originally collected specifically for the purpose of the investigator's research, right? They're just things in the medical record collected for medical purposes. There's no interaction or intervention done specifically for this current research. Is this secondary research human subjects research? Right? Again, hinge at whether something is identifiable. Yes, this is secondary research. This secondary research is human subjects research because investigators initially have access to the electronic records with individually identifiable data, right? So this is secondary human subjects research. Then you go to the next question, right? Does this secondary human subjects research need to comply with, the common rule regulatory requirements, including formal IRB review? Or, for that matter, a more imminent question, does the entire research that this investigator proposes meet one or more exemption categories? And remember, we're often talking about exemption 4. So I'm going to tell you, well, I think this meets with the potentially with the exemption 4 provision 2, because it says this is secondary human subjects research, and I think it meets that definition because as the way that it was written, right? I'm going to go back and show you how it was written, right? Identifiable initially, we only record data that cannot be linked back to individuals, and they will have no means to contact individuals and agree not to react. So literally kind of all the words that you saw in the definition of, for that particular provision in exemption 4, right? So investigators, if you think that this is your situation and you want to make it very clear and convincing to your IB administrations, your administrators, your IB office staff, so that they will not come back and keep asking you questions and you keep giving them sort of something that they don't seem to understand, this is what you need to do. Go and look at what is said in the exemption for that particular category, and if you think that it fits into it, and you can repeat and use those wordings so that people know for sure, okay, we know what you are talking about. We're using the same language here. Okay. All right. So let's look at scenario 3. Hospital A agrees to provide a team of bench scientists with sputum and lung aspirates left over from clinical procedures involving chronic smokers. The hospital will provide the specimens without any individually identifiable information and will not be otherwise involved in the research. The research team will conduct whole genome sequencing of the specimens as part of their research. Is this secondary research? Yes, this is secondary research because the biospecimens were originally collected for clinical care and not specifically for the purpose of the investigator's current research. There is no interaction or intervention done specifically for this research. Is this secondary research human subjects research? Are the biospecimens identifiable, in other words? So, the biospecimens do not come with individually identifiable information, right, from hospital A. However, investigators are doing whole genome sequencing. The whole genome sequencing procedure may identify something unique to an individual, right? But the investigators, in my opinion, right, these are bench scientists, they're unlikely to be able to use this information to readily link the biospecimens back to living individuals. That's my opinion. Therefore, I would say that I would consider it as not identifiable, and hence this is secondary research that is not human subjects research. So I'm going to ask another question. Is Hospital A, the supplier of biospecimens, part of the research team? not under the common rule, as long as the supplier does not have any other role or intellectual input into the research. That hospital A staff is solely providing materials. Of course, they're complying with whatever policies and other regulations that they need to comply with in order to provide that information, that materials, right? So they're meeting on compliance with all those kind of other requirements, but there's no common requirement for them to comply with, right? Again, I'm going to urge you to say, don't call them collaborators to help your IRB administrators interpret, right? Whether you can go ahead with your research or not, right? And the other thing is, I would suggest not to give people like, suppliers gift authorship. If you go and look at the ethics of authorship, it really, you're not supposed to be doing that kind of thing at all, right? Second, scenario 4. All right, an investigator wants to review aggregate data for buprenorphine prescriptions to patients with opioid use disorder who present to hospital ERs. She wants to see if a checklist she implements for ER physicians to use when treating patients with the disorder would increase the prescription rate and improve care for these patients. So is this secondary research? I paused there because I wanted to give you a bit of time to look at that scenario again. Right. The investigator asked to review data that are routinely collected. However, her research interest involves a difference in prescription rate as a result of an intervention, the checklist that she introduces for the research. So even though the data that she is going to be using for her research are data that are routinely collected. However, don't forget that there is an intervention procedure intervening there. This is primary human subjects research. So the lesson to learn here is, don't just look at the source of the data the investigators are getting for their analysis. Typically, research has a hypothesis and certain outcome expectations. Remember the definition of research. What is research, right? So usually there's a hypothesis. There is a systematic collection of data to answer the question. If you are reviewing a protocol submitted to your office, you need to know, you need to understand the whole research. What is the research, right? And understand how the activities that are being proposed make sense to that research, and not just look at, what data the researchers are analyzing and then and then jump to conclusion and say, well, this is secondary research because they're using things that are routinely collected. No, you need to look at what the research is, right? The purpose of it and everything. So this is primary research. Scenario 5. A team of investigators has refined an intervention that is shown to be effective in blocking the proliferation of animal kidney cancer cells having certain genetic expressions. They want to test the intervention on human kidney cancer cells with the same genetic expressions. They would do this on leftover cancer kidney cells obtained from patients who had participated in an earlier kidney cancer clinical trial that they were involved in. So their physician collaborators who collected those, cancer cells or in the previous clinical trial, these collaborators will provide them with the biospecimens, and they will only provide them with coded biospecimens. All right. Is this secondary research? Yes, this is secondary research because the biospecimens were not originally collected specifically for the purpose of the investigator's research. There is no interaction or intervention done specifically for the research, for this current research. Notice how I've been using the same text and wording over and over again. I urge you to go through this process like I do each time, right, when you're looking at a protocol. So, second question, is this secondary research human subjects research? In other words, are the biospecimens identifiable? So here's my analysis. The biospecimens are coded and are provided by the physician investigators, collaborators in this particular situation, with whom they had collaborated on a prior clinical project. I put in parentheses here because I suspect that the current research is potentially related to the previous trial. It is quite probable that these investigators are continuing their collaboration with those involved in the previous clinical trial. As part of the research team, everybody being part of it, they are likely to be able to readily link the biospecimens back to individual participants. Sorry. So so again, see how I'm looking at the details of the case and trying to make sense of it, right? Now, I'm going to say probably that I would suspect that they're really all working together, and this is a continual and enduring relationship that they have. And so, yes, they said coded, but I suspect that it will not meet that, it will not, so the definition of identifiability in the common rule, I suspect that it will not be considered as not identifiable under that definition. So will this secondary human subjects research need to comply with common rule requirements, including formal IRB review? In other words, you want to ask that first question first. Does it meet an exemption? Does it meet the conditions for exemption 4? And remember, we pointed out exemption 4 provision 2 and 3 potentially can be used, right? So if the entire research can meet one or more of these exemptions, then it doesn't matter whether it's still human subjects research, because it may qualify for one or more exemptions. So let's look at just a reminder of the exemptions, provision 2 and 3. And what are your thoughts about that? So, will the HIPAA exemption at provision 3 work, assuming that all the investigators work in a HIPAA-covered entity? No, because there is analysis of biospecimens, not just the use of identifiable data for the research, or data for the research. Will the exemption at provision 2, exemption for provision 2 work, since all the research is secondary research? Probably not. Everyone seems to have an enduring interest in the treatment of kidney cancer. Even though the proposed research project is a seemingly independent project, the investigators are likely to want to maintain the ability to link the results back to identifiable individual patient participants of the previous clinical trial. And there are probably means for doing that, because these are physician collaborators who are providing the specimens. So I'm going to suggest that this will most likely be secondary, non-exempt human subjects research that needs to follow common rule requirements for IB review and informed consent, etc. Now, your investigator can contest that, and if so, then they have to come back and give a convincing case of how, it's not identifiable, we've severed that relationship, we cannot link back, right? And so on and so forth, okay? So scenario 6, this is the final scenario. A physician investigator of a large methadone center wants to find out if opioid drug users with a particular genetic polymorphism are more likely to relapse on methadone treatment. She will conduct genetic analysis of blood samples left over from clinical collection and obtain patients' methadone treatment and clinical care information from their records for a year for analysis. Is this secondary research? Yes, this is secondary research because both the biospecimens and the data are originally collected for clinical purposes and not specifically for the investigator's currently proposed research. There is no interaction or intervention done specifically for the currently proposed research. Is this secondary research human subjects research? Are the biospecimens data identifiable to the investigators? So the biospecimens do not come with individually identifiable information. However, the study is longitudinal, and the clinical data need to be linked up with the biospecimens for the purpose of the study. Since the investigator also works at the center, it is quite probable that she will be able to readily link the materials back to living individuals. Therefore, this is likely secondary human subjects research. Now, again, you can contest that. The investigator can contest that. Investigator says, yeah, I work at the center, but this center is huge, and I'm really just a bench scientist. I don't have access to medical, electronic medical records. Well, so you, again, need to look at the details to make the ultimate determination. So on this occasion, since I'm, suggesting that, this investigator has access to electronic medical records, can link the materials back, so most likely, the exemption 4 provision 2 will not apply either. I'm going to ask the first question. So could the use of an honest third-party broker help make this secondary research be not human subjects research? So there have been situations, and we see this quite often, people will introduce a third-party broker, an honest broker, somebody who would come and let's say, okay, well, we will strip the individually identifiable information from the biospecimens and then provide it to the investigators. And we will also help link the, medical information data over time, and then provide to the investigators. But, in so doing, we will also make sure that there's a signed agreement that, we will never divulge, the information, the identifiable, individually identifiable information to the investigators, right? So if you have introduced a third-party broker in this case, then can you actually say, okay, then looking at this, the investigator is receiving all this material for the research, right? That they're really not, so they are doing secondary research. We confirmed that already, that they really don't have access to identifiable information. So you need to be able to answer that question. Now, I'm not going to answer that for you because that depends on a lot of things, right? It depends on, like I said, whether this so-called investigative scientist actually has himself or herself access to the electronic medical records, and what details of information are being extracted from the clinical record, and whether with that amount of details that somehow that this person may still likely be able to, identify individuals out of that, right? So these are all sort of things that you need to consider. Is very subjective. It depends on the case. It depends on the details. So there you go. I'm not giving you the answer. I gave you the route to finding the right answer. All right, we've finished with the scenarios. We have a few more slides. What do the regulations require for human subjects research with no applicable exemptions? Well, that really means that it's non-exempt human subjects research, right? And so if it's non-exempt human subjects research, then the typical requirements under the common rule, filing an FWA in order to get the money to do the research, having a formal IRB review that goes through all the review criteria at 46.111, getting informed consent from individual participants for their participation, unless, it meets the condition for a waiver of informed consent, and the IRB has made that determination, right? So you need to think about all those, and that would be that would be a case where, all the common rule regulatory requirements that, we've all heard about would probably apply, right? I want to point out here that, under the revised common rule for the waiver of informed consent, there is a new requirement that needs to be satisfied before the IRB can waive the consent. And it is that the research could not practicably be conducted without the materials in an identifiable format. Now, on the right, I'm showing you for IRB, even for IRB, formal IRB review, there are two pathways, right? You can either do it through under the expedited mechanism or the full board mechanism. And under the expedited mechanism, there is an expedited category that is specifically useful for secondary research, right? And it's category 5. So when the following conditions are met, right, it's category 5, it says research involving data, documents, records, or specimens that have been collected or will be collected solely for non-research purposes. Now, I put in parentheses, that's something that in bold, something that is not actually written in that guidance document, but it's traditionally how OHRP have been interpreting this. And that could be useful for you in interpreting and applying this expedited category. Notice also that you need to also make sure that the research procedures must present no more than minimal risk to subjects. I guess this is really more data analysis, right? So it probably is not that relevant. And that it include protections for privacy and confidentiality as appropriate. So very relevant, even for secondary research, right? So expedited research means that you need to have one designated IRB member reviewing it, not the entire board. So that's where the expediency is, right? Instead of having to call in a whole board to do the review, you just have one designated IAB member reviewing it. They still need to go through 46111 criteria for the review. And the good thing here with the revised common rule is that once that initial review is done, and if nothing changes with that research, then that may be the only review that needs to be done. There's no continued review needed. So last but not least, a summary for all the investigators out there who are thinking about doing secondary research. What are your options, right? So first option, if you can, right, for your secondary research with data and biospecimens, try to use non-identified data or biospecimens, right? If you do that, right, you really cannot link, in other words, you really cannot link back to individuals. There's nothing that is, associated with the identity of the individuals on those biospecimens or data, right? Then you're doing not human subjects research, and you don't even have to think further about whether the other common rule regulatory requirements apply to your research or not, right? So the second way is, okay, you try to meet all the conditions. So you may have some access to items at the beginning, but try to see if you can meet the conditions for an exemption, right? And exemptions 4, 5, 7, and 8 are the exemptions that may be applicable for secondary research. Exemption 4 is the most commonly used. Exemption 7 and 8 require limited IRB review, including broad consent. We haven't gone into detail, and I don't intend to talk about that in detail in this particular presentation. And then the third one is, okay, well, exemptions don't work. So you're dealing with a case of non-exempt human subjects research. So we've talked about that. You require formal IRB review. It could be expedited potentially. You probably require informed consent to use the identifiable materials for secondary research, but there may be a case to be made to the IRB for the IRB to waive consent. Right? If consent is needed, the consent will be either standard consent or broad consent. And like I said, if you can, convince IRB that the conditions are met and that they could waive consent, then you can potentially, have a situation where you can do the research without going to get consent. Right. And again, a reminder, regardless of whether at the end of the day, the common rule regulatory requirements apply to your research, regardless of whether, okay, yeah, they apply, but then, yeah, and that we're compliant with the regulation, regardless of any of that, please remember that there are ethical considerations and responsibilities to think about. And those are beyond the regulations, right? Beyond the scope of it. But please, 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 in this society where we really need to rely on trust, right? Then think about all that aspects. And in this climate where we have all sorts of, AI research and secondary research going on. So please be respectful. Please think about your, people who are providing the data for the kind of research that you're doing, whether it's, sensitive, whether there are any issues that you need to think about, and how you can best protect the information. So these are a list of OHRP resources. When you get your slide, you'll be able to see them and access them through the links. Announcements, we have shown these at the beginning. There is a OHRP Research Community Forum coming up at the end of March in Knoxville, Tennessee. It is Research in Age of Technology, is very, very relevant to what we're talking about here today. Secondary research, I mean, there's a lot of, there's going to be a coverage on AI research, a lot of data, research with data and biospecimens use. Right. You will be able to get a set of the slides after the webinar. It'll be posted on our website. You can go to OHRP, look for the news tab at the top of the page. And once you're on that page, look for past events, right? This would be in the past. And then you'll find the slides. With that, thank you very much. We have a few more minutes. We have about another 15 minutes. I can address questions. So hopefully this presentation has been useful to you. Next week, I'll be talking about a similar topic. It'd be secondary research, but it will be related to repositories. Okay, so if you have any questions related to repositories, we'll save them for next week.
Thank you so much for that fantastic presentation, Yvonne. It was very informative and educational, and I hope that our audience was able to glean what they needed from it, or at least learn a thing or two. As you mentioned, we do have about 16 minutes for questions. So I'll go through and kind of let you know what came in through the chat, and hopefully we can provide some more answers and information. So the first question, and R asks, are there particular steps to take when looking at potentially identifiable secondary research when vulnerable populations may be included?
So I guess, Michael, is it really at the end of the day, a question about identifiability?
I think from my point of view, it'd be more talking about these populations because it's secondary research, but it is identifiable.
So can you repeat the question again? Sorry.
Sure,
I didn't quite get the essence of it.
Sure. Are there particular steps to take when looking at potentially identifiable secondary research when vulnerable populations may be included?
Okay, so I guess this question is not so much about the ethics of doing research with vulnerable populations. Obviously, because you're dealing with vulnerable populations, then you want to be particularly conscientious, if you like, about because of their vulnerability, that you don't want to expose them or exploit, or do things that would potentially be seen as exploiting them further. So I think it's a level of sensitivity, and it goes really towards like, think about the ethics, think about your ethical responsibilities. I don't know that there is any sort of good, step-by-step things that you need to follow. I personally would think that anytime that you want to do research on any group of populations that are, that you can potentially kind of single out, you should really try to get a good understanding, some level of, understanding of, this population, whether it be through direct communications with some members of this population, or whether it be really just doing your due diligence to find out more about, some uniqueness about this population, right? So the more you understand your potential research participants, the better your research is going to be, even at the point of the design stage.
Thank you. And again, I think it gets to your take-home message that speaks to trust with the public. It's a partnership research with the researchers, the institutions, also with the public and the participants who are coming.
Yeah,
and,
it always pays to be respectful.
Absolutely, absolutely. Next question's from Lisa. Could you speak to what would make a supplier of samples or data rise to the level of a collaborator? And is a collaborator considered an investigator for the purpose of identifiability definition? So you did speak to this a little bit, but here's an opportunity for you to talk about this again.
So, honestly, at the end of the day, you can call whoever, whatever you want to call them, right? I appeal to you, investigators submitting a protocol to your HRPP office or IB administrators to use the word collaborator with some care, right? Because you don't want to confuse your IB administrators and HRPP staff, because the moment they see that, well, they start wondering, okay, now Nick, come to the essence of your question. What would make somebody a real collaborator, right? So if you're going out to ask, some physicians, right, in a hospital and say, look, please go out and do this specifically, right? Do this activity, interacting, right, or intervening specifically to collect, information to supply for the purpose of my currently proposed research, right? Then this is clearly you asking somebody to collaborate with you to do this research, right? The person is actually doing something collaboratively that matters under the common rule, because it turns it into a primary research project. Right. Again, I'm always talking from the perspective of the common rule, because we are talking about how we actually interpret and apply the common rule here. Right. So that is, anything that I say when I say, well, don't refer them to as collaborators, from the perspective of the common rule, because you don't really want to, if it's not the case, if this person really genuinely from this, other institutions, genuinely only, helping you with, just giving you things that already exist one way or another, right? There are information or materials that are coming in one way or another, that they're not intervening in that procedure. They're not because of your research, they're doing something to make that they're going to collect more of it, right, from people, or they're going to do special things to individuals in order to satisfy your research, right? If that's not the case, then this person is really generally just providing, right, supplying. The other thing that we look at is intellectual inputs, right? Apart from just giving you saying, is there any other kind of intellectual inputs, right? And the more there is, then the more it becomes likely you may be entering into a case of collaborative situation. Because as you all know, when you do publish, right, people look at the intellectual inputs. I mean, I understand for a start that in terms of deciding on authorship, right, who comes first and second and third, you look at the percentage and the level of intellectual involvement, right? So, if your supplier is also somehow intellectually closely involved with your research, that could potentially make that supplier not only acting in the role of a supplier. And that could affect how those people are making a determination as to whether your research, human subjects research, identifiable or not. That could all ring all the bells. And again, then we need to look at the details of this, collaborative effort and what it means.
Thank you. And again, just to paraphrase, so it doesn't matter what they're called in the research protocol, it's the activities that they're actually engaged in.
Yeah, and I just saw research is by definition necessity of often collaborating. What is the problem with having No problem with having collaborators. No problem with calling anyone any way you like, right? I reiterate, it is just for the purpose of applying and helping your IRB administrators and HRPP people apply and interpret how the common rule applies to your research or not.
So moving on, we do have a few questions about your genetic analysis on samples. Well, first off, Rebecca says that she appreciates the opinion on genetic analysis on samples without identifiers, as she wasn't able to find any guidance on this. We have another question asking, with regard to genetic sequencing information not being identifiable, is it true that the identity would not be readily identifiable to investigators? But what if investigators put the genetic data into a public repository? Genetic information is uniquely identifiable, so presumably in the future, could this be a privacy risk?
Yeah, I mean, this is a really hot topic, right? And it's really contested, right? As to, the requirement now for sharing information. I have to admit, I have never done, obviously whole genome sequencing research.
Right.
I really don't have a lot of detailed knowledge. I guess at the end of the day, the devil is in the details, right? And, you just have to make the case as to whether, this again, I mean, look at the definition. It's related to readily ascertained by the investigators, right? It's not by the whole world out there, by some experts who have all the ability and techniques and technologies access, right? So I think that does actually, kind of draw a line around, what we're talking about. Now, like I said, this is an evolving situation. And yes, I agree, it may get to a point, I mean, as we are in the kind of world we're living in today with so much high level technologies, it could very well be evolved to a day where, this becomes like the recent hot topics, the chatbots, right? Being able to write all these articles and beautifully, right? Who knows, right? Maybe very soon we'll have some other bots that could do some deciphering and, link people up easily. Well, maybe, and maybe we should start thinking about that in terms of how we think about identifiability. And I'm an educator, I'm not a policy person. So, I hope that the policy people are thinking about it. I appreciate your concern.
We do have a question about the order in which you would be asking the questions. Do we ask if the research is secondary first, and then if the research is a human subject research project next? Or so if you wouldn't mind walking through the questions that we ask to determine.
Okay, so the three primary questions, right, is is it research? If you say yes, right, you've determined it satisfies the definition of research, you go to and ask the next question: is it human subjects research? Right, and this is the time where you look at, okay, right, does my research fit into the human subjects definition? There are two parts to the definition, as I have shown you, right? Anytime that your research satisfy one of them, the interaction intervention part, right, it is primary research. You cannot get out of, you cannot go back and say, well, it also satisfies the second part, right? So I take the second part, not the first part. No, anytime that it involves collection of data through intervention and interaction, right, with humans to collect their materials, individual identifiable information about specimen, you have a case of primary research. It's only when, okay, you cross that, like I did in my slide, and then you still, before you go away from the question of is it human subjects, you still need to look at the second part, right? It's only when the second part also does not apply that you can call it not human subjects research. But if the second part applies, right, whereas the first part didn't, then you have a case of secondary human subjects research. Then you go on to the next question, which is it exempt? Is it helpful?
I think so.
Sorry, I forgot that people can't really say.
So we have in your fifth scenario, in scenario 5, we have what category of non-exempt research would you place this research under? So I guess possibly they want to know the expedited review category.
Okay, so first of all, right, the scenarios are created, most of them based on sort of, things that we've seen, right? But, some of them can be just made up for the purpose of this. So don't go and, tell me, oh, well, this doesn't make any sense whatsoever in the real life. That's not the purpose. The purpose is try to use it as an educational tool. So in the case of scenario 5, as I have presented it here, right? And just to remind people, so the one about the kidney cells, the animal, again, it's my conjecture that because most likely these people are working together, right, as a group, and and that they really have, they're really able to readily link back to individuals. So you really have a case of probably non-exempt human subjects research. And if that is the case, then you really need to think about, okay, well, we need to have an IRB review. We need to think about informed consent, or whether IRB can actually waive the informed consent or not. This particular presentation is not to help you figure all that out. We're just focusing on the secondary research, so it's not really the best time to talk about it. We will be doing presentations on informed consent, and then another series will be coming probably in May and June, where we'll talk about IRB procedures and IRB structures and so on.
Great. So we do seem to have a couple questions about expedited category 5. Anthony asks, when you say have been collected for research or non-research purposes, do you consider it in the frame of the sample being collected or the protocol being reviewed?
So the expedited category is research involving data, documents, records, or specimens. These things have been collected for research, so another research, obviously, not the current one, right? And or for non-research purposes. So the first part of that expedited sentence, right, before the or part, right, really fits into what we have been talking about over and over, secondary research, right? And then the second part after the or, right, research involving data, documents, records, or specimens that will be collected solely for non-research purposes. Why only for non-research purposes? Because if it's not, then you probably be collecting it for this current research, right? So then it would kick it out. It's not, and then it would really be about primary research. So that is the reason why I say that this expedited category 5 is one that is relevant for secondary research. And the bolded, qualifiers I provide for you is not actually in the regulatory text to help you to clarify how we've been thinking about it, because there's some ambiguity. If you read it without the bolded parenthesis, the statement in the parenthesis, there's some ambiguity there that was not meant to be.
Right.
I was
And
told.
thank you. And Iris writes on the same topic. We have often struggled with categorizing projects as expedited 5 when the data was previously collected for research purposes. Am I understanding that we can use this category in that scenario?
Yeah, if it's secondary research, in other words, it's previously collected for research purposes, not for nothing to do with the current research. Right?
Correct.
Yes, to that question.
So let's see. Do you think there are issues with an honest broker using fully identifiable data to create de-identified data sets for a research purpose, such that the identifiable data is being used for research so as to trigger common rule requirements? Actually, now as I'm reading that, I don't know if I entirely understand this. Using a fully
It's okay, Michael. Let me just say a few more words about honest broker. I
thank
think
you.
a lot of people use honest broker as a kind of a go-between, somebody who has access to identifiable stuff and can do some minimal procedures to, provide the data downstream. And if you look at the downstream investigators, that particular investigator is really only interested in, in things that are not identifiable to them, but they do a research that relies on some of this kind of information. Now, the common rule is there to provide some baseline to regulate research, so that there's a level of protections and a level of requirements that investigators follow that would sort of at least contribute to providing some safeguards for participants, right? But at the same time, don't forget, when we do research, there's a very strong beneficence side. I mean, hopefully all the research that we're doing, the ultimate goal, and we're thinking about, we're designing research, we're creating research, and the goal is to contribute generalizable knowledge, to contribute to the public good, right? Especially HHS funded ones, right? So hopefully, we are saying that, the research you propose to do is, sufficiently valuable, potentially it's a public good. And if that's the case, then, it's a balance, right? You don't want to create so many barriers and obstacles that it's impossible to do the research just for the sake of being able to protect, that little bit of risk, right, that may be involved, right? And so I think, many people use honest broker. I think I would look at it this way: as long as, if somebody is proposing to use honest broker, you come back and look at the downstream investigator and you kind of look at the research. Okay, with the use of honest broker, does it meet that definition of identifiable or not? If you can make a case, if the investigators can make a case to you that, okay, in the use, if they're able to use an honest broker, and that it could, by using that, they can satisfy that definition, in the sense that it would not meet that definition of identifiability, then fine, let them do the research, right? Why create overly cumbersome obstacles? Now, I cannot tell you on, this would be the situation in every single case. Again, the devil is in the detail. I don't have the details. I created a scenario to give you some idea of how we look at it. And that is the reason why, when Michael Grapaldi here, who was looking at my slides, he suggested, why don't you say something more about honest broker? I was thinking to myself, well, what can I say that is universally true that I can put on the slides? Nothing. So that's why I left that there for you guys to think about. And so hopefully, by hearing what I've said, that helps you think about it a little bit more.
Well, thank you, Yvonne. We did have a few more questions, so I think your general thoughts on it are well received. And we are at time. Yeah. We are past time. There are several questions that we weren't able to get to, so we'll do our best to reach out and have your questions answered. But if not, as Yvonne stated at the end of her presentation, we do have a main inbox, ohrp@hhs.gov, that, thank you, that you can submit your questions to if they're more individualized, and we try to get to them in about a week or so. You'll have a response, normally sooner. Yvonne, anything to close with?
No, come and join us for the webinar next week. Be kind of a similar subject on data and biospecimens, but related to the repository. And that creates a lot of confusion as well. So come back.
Have a good afternoon.
Bye-bye.